Okay, hi, my name's Callan. I'm going to be your nurse for today. Before I enter the room, I'm going to assess for any safety precautions, and then I will also perform hand hygiene. So I'm going to write my name on the board and the date. Can you please verify your name and date of birth for me, please?
Sydney Perry, February 9th, 1999.
Okay, thank you, and that's what the wristband says. So today I'm just going to be doing a general inspection on you. I'm going to assess your cardiac, your hair, your head, ears, eyes, nose, throat, your lymph, your respiratory system, and your abdomen. Is that okay?
Yeah.
Okay, so first I'm just going to do some vital signs. So just go ahead and put that on your finger, and then just rest that on and don't move for me. Okay, so your respiration rate was about 14, which is normal. Your pulse ox is 99, and then your heart rate is 66. So all of that is in the normal range. So then I'm gonna do some blood pressure. Is that comfortable?
Mm-hmm.
Can you tell me what your blood pressure normally is?
120 over 80.
Okay, great. Okay. So I got 122 over 76, so that's normal. Okay, and then I would also assess your temperature, but I don't have anything to do that. So for general inspection, my patient is talking in coherent sentences. She's dressed appropriately for the location. She's oriented to person, date, and place. So next, I'm just gonna assess your pain for a second. So can you tell me what brings you in today?
I've been having some chest pain.
Okay, so with that chest pain, can you, on a scale from 0 to 10, with 10 being the worst pain and 0 being no pain, what would you rate it?
About 4.
Okay, and then can you tell me when this started?
About a week ago.
About a week ago?
Mm-hmm.
Okay, and you said it's in the chest. Is it in a specific location in your chest, or is it all over?
Towards the center.
Towards the center, okay. Can you just point at where it hurts? Okay. And then can you tell me how long it usually lasts? Is it like immediate pain? Does it like constant, or does it go away?
It comes and goes.
Comes and goes. With the coming and going, is there anything that alleviates the pain? Such as like laying in different positions?
Yeah, like if I lay down.
Lay down, it goes away. And then is there anything that like causes the pain? Like anything that you seem like to start the pain? Like eating, or if you like stand up for too long, or anything like that, like physical exercise?
Yeah, usually after work, standing a long time.
After work, standing a long time. Okay. And then, is there a certain time of day that this usually starts?
Not really.
No. Okay. And can you like describe the pain to me? Is it like throbbing? Is it more stabby?
Kind of shooting.
Shooting pain. Okay. So I'm going to document all that and then I'll tell the doctor.
Okay.
So next I'm going to do a general skin assessment on you. Is that okay?
Yeah.
So first I would just start off with the hair. So overall the color is nice. I don't see any graying. It's nice and smooth. It looks well cared for. It has good hygiene. Looking at the back of the neck, I don't see any knits, so that doesn't show any signs that you have any lice or anything. So that's good. So moving down to the face, I'm just going to look at the general appearance of the face. So overall, I don't see any blemishes or any lesions on your face. Your eyebrows are symmetrical as well as your eyelashes. So overall, no problems. I don't see any crusting anywhere near the mouth or near the nose. So that looks good. And then I'm going to assess the ears. So overall, it looks fine. There's no lesions near there. And then I will continue to move down, look at the chest, and assess to see if there's any lesions. I don't see any there. And then looking at the arms. So the patient has a couple freckles up here. So they have a couple macules. None of them look all of them look like they fit the ABCDEs of moles. So I'm going to keep moving down. The patient has a bruise on the left hand. So that looks fine. It just looks like it's slightly healing. No problem. Again, there's some more macules down the arm. But overall, those are nothing to be concerned about. And then I move to the other arm. So again, macules on the shoulders. It looks normal. Both shoulders have freckles. Looking around, just macules. All of them fit the ABCs. None of them look to be concerning. And then I would move down to the legs. So patient has like slight bruising near the ankles, but they look to be healing as well. Nothing that looks too bad. And then on the other leg, I don't see any issues. The color is warm and dry to the touch, as well as in the upper extremities. Just a few bruises, nothing to be concerned about. So I'm also going to assess your skin trigger. So I'm just going to pinch your skin. It should go right back. Problem, and then I'm going to do that on your legs too. Okay, and then I'm also going to assess your capillary refill. So I'm just going to pinch. Those are fine. And while looking at the hands, I'm going to look at the fingernails. Fingernails have good hygiene. They don't look like they're poorly taken care of. They're nice and pink. I don't see any lesions or any other problems with the nails. Overall, the skin looks pink, and it's also all warm and dry to the touch, which is good. For toenails, capillary refill is also under 3 seconds, so that's fine. I don't see any lesions on the feet, and then those toenails look well taken care of as well. So overall, the skin is warm and dry to the touch. I don't see any lesions. So if I did see any lesions, I would indicate oozing, like any discharge coming, the color, and any other problems that are faced with the skin lesions. Overall, the body looks good. So now I'm going to go ahead and do head, ears, eyes, nose, throat. So I already assessed the hair. So then moving down to the face, once again, everything looks symmetrical. The eyeballs look symmetrical. I'm just going to pull down on your eyes and then you can look up for me, please. Good. Good. I don't see any discharge in the sclera. I don't see any discharge, and the conjunctiva and the sclera look good. Pupils are about a 4 right now. That's normal because this room is a little bit darker. And overall that looks fine. And then I'm going to look in your nose. So I'm just going to look under. You can close your eyes. Okay. So I don't see any discharge in your nose, coming out of your nose. The outside of your nose looks perfectly fine. I don't see any crusting, and I don't see any issues inside of your nose either. So now I'm going to look at your mouth. So overall, on the outside of your mouth, I don't see any problems. Can you please open your mouth? And then can you say ah for me? Okay, so the uvula goes up and down, so that's good. That's one of your cranial nerves. And then can you stick your tongue out and move it left to right? And then that's good. And then can you swallow for me?
Why can't I do it? Okay. Yes.
Good. So all of your cranial nerves are intact, so that's good. So I'm going to go ahead and look back in your mouth, and I'm going to look at the hard and soft palate, and I don't see any lesions. And then look at those, and then can you lift your tongue up for me? I'm just going to look under your tongue. Okay, good. I don't see any lesions in your mouth, and then your teeth are nice and white. I don't see any cavities or anything. So now I'm going to move to the ears. So the outside of the ear, once again, I don't see any discharge or inflammation, as well as on the inside of the ear, I don't see any discharge. I see the normal earwax, but that's normal. All ears have that. And then I'm also going to assess the other ear. Okay, that's good. Once again, I don't see any discharge. So, can you do me a favor and can you smile for me? Can you frown? Can you raise your eyebrows? Okay, good. So all of those cranial nerves are intact. And then can you plug up one nose and sniff in? And then plug up the other nostril. Okay, good. And then can you close your eyes and tell me which ear you hear this in?
Left.
And then which ear you hear this in?
Right.
Okay, good. Okay, now I'm going to do a couple assessments on your eyeballs. So first, I'm just going to have you look at my pen light and then follow it. Okay, good. Now you can blink your eyes and let your eyes relax for a second. So now I'm just going to check the corneal eye reflex. So just look straight forward, don't look directly at the light. Okay, that's good. I'm looking to make sure that both of the sparkles are the same in each eye. Okay, now I'm just going to look at pupillary reaction. So if you look forward again for me, and I'm just going to test your pupils. Okay. Okay, good. Both pupils reacted equally, so that's good. Okay, so now I'm going to test the peripheral eye test. So we're both going to cover the same eye. Okay. So cover the same eyes, like across from me.
Okay.
And then can you tell me when you see my finger?
I mean, I see it now.
Okay. Like look at me.
Okay.
And then like, when can you see it?
Right now.
Okay, and how many fingers am I holding up?
2.
Yeah. And then switch.
I can see it. It's 1.
Okay.
Yeah. 2.
2. Okay, good. Okay, now I'm going to test your cardinal field of gaze. So just blink and relax your eyes for a second. I know it's a lot for your eyes. Okay, so just follow my finger. And don't move your head. Okay, good. I would do the Snellen chart to test visual acuity. However, I do not have one, so we will just move on with the assessment. So now I'm just going to palpate your neck just to make sure that I don't feel it's nice and even. I'm going to feel your lymph nodes. So, okay, so I didn't feel any of your lymph nodes, which is normal. Lymph nodes only get swollen, and we should be able to like really only feel them if you are sick. So overall, very good. So after that, first I'm going to assess your range of motion. So can you lift your head up for me, please? And down, and left, and right. And then can you look forward, and then can you move your head against my hand? Okay, good. And then again. Okay, and then can you lift your shoulders up against resistance? Good job. Okay, so all of that is good. So next I'm going to move on to your respiratory system. So first I'm just going to, so in the past I said the respiratory rate was 14, which is normal. So next I'm just going to like watch you breathe for a couple seconds, make sure. So this length should be twice as long as the width. So that's good. I don't see any barreling of the chest. The nasals aren't flared. The mouth isn't pursed. This patient doesn't seem to be in any signs of respiratory distress. Overall, it's very good. So now I'm going to auscultate your lungs. First, so this one. And just take some breaths for me, and then if you become dizzy, just tell me. And then I would go under the clothes, but I'm not going to for this video. I'm just going to show you where to keep listening. So right there, here, right here, here, right here, and right here. And then I would also assess the back. However, we're not really able to do that. But once again, I would move across, down, across, down, across, down. So that all looks good. The breaths were equal. I didn't hear any signs of adventitious sounds. So no wheezes, rhonchi. Overall, that looks good. Have you had any difficulty with breathing lately? No. Okay. So next I'm going to move to cardiac. So first I'm going to feel all of your pulses. So I'm going to feel your carotid. Okay. Okay. Then your brachial. Okay. Then radial. Okay. Okay, and then I would also do the posterior tibialis and the posterior dorsal, but I will not be doing that right now. So moving on, overall I don't see any signs of bluish color in the ears, mouth, or face. And then can you tell me, have you had any pain in your calf lately? No? Okay. I don't see any signs of edema, swelling, or redness in the arms or the legs, so I don't see any signs of deep vein thrombosis. And then have you had any chest, you said you had chest pain, we already went through all of that, so that's fine. So next I'm going to be doing an abdominal assessment. So first I would just ask the patient if they've had any problems with your stomach lately, any issues. No. Okay, and then I would ask the patient what their urine output, what their urine looks like and what their stool looks like, but I will not be asking this patient. So then next I would auscultate the stomach. I'm not going to ask the patient to lift their stomach up right now, but I would listen to all 4 quadrants just to make sure that I can hear sounds in each of them and what kinds of sounds I don't want the stomach to be overactive or underactive. And then I would also auscultate for the aorta to make sure they don't have an aortic aneurysm, and that's just going down here, down the midline. And then next I would palpate using a light touch. If the patient was ticklish, I would try as best as I can, or I would have the patient put their hand under mine just so they can feel what it feels like, and then switch my hand under theirs. Also, something that I forgot earlier, I would also need to find all of their landmarks, so their clavicles, their suprasternal notch, which is here, angle of Lewy, which is here, and then there's your sternum. Their xiphoid process would be down here, and then their ribs. And for the digestive system, we use the umbilicus as a reference point as well. So after palpating, I would just do all the quadrants, and the quadrant that has the pain I would leave for last. So overall, that looks good. They don't have any signs of any difficulty with that. They don't report anything. So once again, a patient reported, what did you report for pain again? 4. A 4. So they reported their pain of 4. I didn't see any difficulty with their integument system, the head, ears, eyes, nose, and throat assessment. Everything came out normal. Lymph system came out normal. Respiratory and cardiac and abdominal, I didn't hear any irregular sounds. I heard S1 and S2 clearly. There was no S3 or S4. Overall, the patient looks pretty healthy. Any interventions we may need is to deal with their chest pain. Okay. Do you need anything else before I leave? No. Nope. Okay, so for patient safety, here's your call light. I would put the bed rails up. I would put the bed in the lowest position. Make sure the bed alarm is on. Make sure there's no clutter in the room, and make sure that they have their bedside table. Okay, so the doctor will be in shortly. Thank you so much.
Thank you.